Good afternoon and welcome everybody. Thank you for joining us today. My name is Andrew Dauphney and I'm the Instruction and Outreach Librarian at the New Jersey State Library. And it is my pleasure to present our presenters today, Laura Moran and Mindy Komosinsky from Capitol Health. So thank you both for being here today. We'll just go through a little bit of housekeeping items before we get started. First and foremost, do some introductions. Laura Moran is a registered nurse and certified diabetes care and education specialist with over 22 years of experience. She is currently program coordinator of the Outpatient Diabetes Education Program at Capitol Health and continues to provide skilled education to the clients of Capitol Health endocrinology specialists. Mindy is a registered dietitian and certified diabetes care and education specialist. She has been part of Capitol Health for over 30 years, where her main duties include individual outpatient nutrition counseling, group diabetes education classes, and presenting programs to the community such as this one. So again, welcome Laura, welcome Mindy. Thank you very much for joining us today.
Thanks for having us.
Absolutely. We will be taking questions today. There'll be essentially two portions of the presentations. Laura is going to present the first half and Mindy will present on the second half. And we will be stopping in between to take any of your questions as well as at the end. So please use the questions box on your GoToWebinar dashboard to submit your questions at any time. Or if you feel it's easier to email me, my email address is on the screen there. And as I said, we'll be stopping halfway through and then at the end to answer your questions. There are a couple handouts in the handout section of the dashboard. One is a listing of upcoming classes that are diabetes related, and the other one is a meal prepper nutrition guide. So please take a minute to click on them, download them from the handout section. If you are unable to download them for whatever reason, do not worry. They will be available in a follow-up email. There is a survey that will be prompted at the end of this program, as well as in a follow-up email. As we always ask, if you could please complete the survey, we greatly appreciate all of your feedback. And lastly, on my last bullet point, if you were looking for more information on diabetes and diabetes services available through Capitol Health, you can visit the link on the screen here. I will send that out in a chat message so that everybody will have a live link to that. For those of you who might be new to GoToWebinar, if you're using a PC or a Mac, this is what your dashboard should look like. If you are using a mobile device, depending on your device, your dashboard is going to look different, but all of the features will still be there. At any point, if you're having an issue, you can use this raise hand button here. That'll alert me and I will get in contact with you and hopefully we'll be able to resolve it. If you're having problems with your audio, make sure that your computer audio is checked and your speakers here are the right speakers that you're supposed to be using. If you're using a built-in speakers or using a headset, make sure that that is selected appropriately. As I mentioned, there are handouts and you can just click on each individual file. It'll open up a new window and download it for you. And lastly, again, questions. There is a questions box. You can type in your questions. That'll get sent to us and we'll be happy to answer that. So that is everything that I have for you. So it is my pleasure now to turn it over to Laura.
Okay, thank you, Andrew. I'm just gonna share my screen and pull up my PowerPoint. Just confirming everybody can see that, right? Are we good?
Yep, looks good.
Okay, fantastic. Thank you for the introduction, Andrew, and thank you all for being here. Again, my name is Laura Moran. I'm a nurse and a certified diabetes care and education specialist. My presentation is going to focus on medications, and we're going to go through all the medication drug classes that are available for diabetes management and hopefully answer any questions that you may have about them. We're going to talk about the process of diabetes that actually happens in the body because I feel that that's really important to understand how the medications are working. We're going to talk about two situations that could be happening in your body. One is insulin resistance, and the other one is insulin deficiency. We'll discuss the different medication options for treating diabetes, and then I'm going to talk about safety, the proper dosing, and the precautions for each of the many drug classes that we use to treat diabetes. So first and foremost, I want to talk about what's happening inside of the body. I think it's really important to understand the process of diabetes in the body so that we can kind of move forward and understand how the medications work. So when you eat your food and you chew it up, it breaks up into different components. You have vitamins, minerals, water, proteins. One of the components of food is carbohydrates, and carbohydrates turn into sugar. And that sugar gets absorbed into your bloodstream. And that sugar in your bloodstream is your energy or your fuel, if you will. So if your body was a car, that sugar would be your gasoline, right? Your car is not going to go without gasoline. The human body is not going to go without that carbohydrate or that sugar that's sitting in your bloodstream. In order for that sugar to leave the bloodstream and get into a body cell to be used for energy, it needs something, and that something is called insulin. And insulin is a hormone released by the pancreas, and that insulin kind of trails behind the sugar in the bloodstream, waiting for a body cell to ask for some energy. So your brain to think, or your lungs to breathe, or your heart to beat. That body cell will say, okay, I need some energy over here. And insulin would go over to that body cell that's asking for that energy and unlock the door, almost like a key. And then that sugar can then leave the bloodstream, enter into the body cells. So when you eat a meal, you get a flood of carbohydrates coming into that body. So you get a flood, essentially, of that sugar coming into your bloodstream. You get a flood of that insulin coming into the bloodstream, trying to distribute that sugar to whatever body cell needs to work in the body. After about 4 hours or so, insulin's job kind of feels like it's done. It says, all right, I've moved that sugar where I need to go. Anything really left over in the bloodstream can be stored in the liver to be used later, or in a muscle to be used later, or it might be converted into a fat, that fat being called a triglyceride. And then prior to your next meal, a little bit of insulin is dripping out, a little bit of sugar is being utilized to kind of keep the body systems in function until the next meal comes in. So I just have a quick picture here that kind of shows again what we were talking about, right? So we have our blue cell, and that's asking for some energy, and we have our yellow key of insulin that's unlocking the door to that cell, and then the little red diamond-shaped glucose is going to enter into that cell now that it is being unlocked by the insulin. So that's kind of how the body system works. So again, our food is our fuel source. In order for us to use our food as our fuel source, we need insulin to unlock the doors and allow that food to get into our body cells. So the situation in diabetes is not necessarily that we can't tolerate sugar, it's that we're having an issue with our insulin. So two issues could be occurring. The first one on the left-hand side is insulin deficiency, meaning that the pancreas is just not producing enough insulin to support the body's needs. And so in this instance, this individual would need to take insulin. It's really the only drug of choice. So there's not enough keys floating around to meet all the needs of the body. The second sentence under insulin deficiency says it's made worse in the presence of a long duration of elevated blood glucose. What that means is if your blood sugars are running high for an extended long period of time, your pancreas is trying to keep up with that. It sees that your blood sugar levels are high. So it's trying to produce lots of those insulin keys to pull down that blood sugar. And if the blood sugar stays high for a really long time, the pancreas gets essentially tuckered out, can get tired, and can stop producing insulin altogether. And so for some individuals, this is a problem that happens. The blood sugars stay high for a long time, and then they go on insulin, and they have to stay on insulin because they no longer produce enough insulin to support their body's needs. Okay, so that's insulin deficiency. I don't make enough insulin. The other situation on the right-hand side is insulin resistance. In this situation, the body is producing plenty of insulin, no problem whatsoever with that. It's just that the body is not responding to the insulin. So it's like the key does not fit the keyhole. So I have to keep producing more and more keys to find like the right one to fit into the hole. This situation is made worse when an individual is inactive or when an individual gains weight. So this is really the starting point of prediabetes and type 2 diabetes. So if you're in that category of prediabetes or beginning stages certainly of type 2 diabetes, this is where your body situation exists. So this is insulin resistance. So in this case, there are a multitude of medications and drug classes that we can use to try and fix this situation, to make your body a little bit more sensitive, if you will, to the insulin, to make the insulin production a little bit more sufficient and efficient. And it may turn over that the individual does need to take insulin, but not always necessarily the case. Okay, so again, these are the two situations that could be happening in your body: insulin deficiency, insulin resistance. So we're going to start with insulin deficiency. And in this case, if a person is not making enough insulin, the only thing we can give them is insulin. So how the pancreas works, how the body works, is that the pancreas is slowly dripping out a little bit of insulin all day long, kind of like a leaky faucet. We call that a basal or background dose of insulin, always trying to give just a little bit to kind of support the body's needs to kind of keep the energy in the body cells as much as possible. When an individual eats a meal, the pancreas recognizes that, and it's almost like you turn on the water faucet. So no longer is it a leaky faucet, but it's a flowing faucet, and a whole bunch of insulin will come into the system to support that need at that time. And we call this a bolus amount of insulin. So two things here: a basal or a background insulin, and then a bolus insulin. So this is how the pancreas works. If we're going to provide medication for somebody who's no longer making insulin, we want to try to mimic what the body does as much as we possibly can. So we have insulin that is a basal or a background type insulin. The long-acting insulin, it provides all-day coverage. You give it once a day around the same time. Some of these you can give, certainly NPH, you could give twice a day, and Levemir can also be given twice a day. But for the most part, it's a once-a-day injection, and that injection lasts for 24 hours. So you inject the insulin, it gets solid underneath the skin, and it's slowly going to absorb over 24 hours. Okay, so it's a background or a basal insulin. And the different types are Lentils or Basaglar, Levemir, Tresiba, Toujeo, and NPH or N-insulin. Those are the types of long-acting or background insulin. But we also have bolus insulin, meant to cover the meals that an individual eats. So this is a rapid acting insulin. It comes on and fast, and it's out of the body within 4 hours. So it has a very small window in which it works. And these are, again, specifically designed to cover a meal. And these drugs are Apidra, Admelog, Humalog, Novolog, regular or R insulin, and we also have inhaled insulin. And again, these are injected right before you eat, and then they're usually out of the system within about 4 hours. So those are the two types of insulins that we typically use when we're prescribing insulin to individuals. Sometimes that regimen can feel a little bit overwhelming, right? So if I'm eating 3 meals a day, I'm eating breakfast, lunch, and dinner, and I do an evening injection of that long-acting insulin overnight, that's 4 injections in a day. And that can sometimes feel a little bit overwhelming. So oftentimes we also have what's called mixed insulin. So it's a combination of long-acting and the rapid-acting put together in either one vial or one syringe or one pen. And then you give it twice a day. So that cuts the amount of injections you need to do in half. So sometimes for some individuals, this is a better option. Insulin can only be delivered through an injection. There is also inhaled insulin as well, but generally through an injection. And it can either come in a vial or a syringe or in an insulin pen. Insulin's not a very stable medication, unfortunately, so there is no oral option. Lots of people ask me that question all the time, and there's just not an oral option, and I have no knowledge of an oral option in the market at any point in the future. When you're using an insulin pen, the picture on the right-hand side is showing you how to insert that. So pen needles are actually very small. They're only about 4 millimeters. They're smaller than really essentially your pinky nail. And they're very narrow. So the pinch is not nearly as painful as other injections that you may think of. And with an insulin pen, because the injection and the needle is so small, you don't need to do any type of special pinching up. It's just holding the skin nice and taut, and then a straight in 90-degree angle injection. With the pens are reusable for insulin, and the needles are have to be replaced each time. So really important that you take the pen needle off of the insulin pen, and then you replace a new one on each time. You just don't want to cause any type of infection or things like that that may happen with the reuse of a needle, okay? So again, pens, insulin pens, straight in injection, no pinch up is required. With a vial and a syringe, because you're pulling insulin out of a vial, those needles are a little bit heftier, so they're a little bit longer. Therefore, you do need to pinch up to ensure that you're actually inserting that needle into a fat layer and not into muscle. So insulin is to be absorbed where we have fat tissue, and we don't want to inject it into a muscle. So I always recommend a 2-finger pinch up. You don't want to use your whole hand and pinch up because you're probably actually going to grab a little muscle. We just do a 2-finger pinch and just kind of pinch up a little bit. You're going to pinch up your skin and you're going to grab the fat with it, and then you'll be able to do, again, a 90-degree angle, straight in injection into that fat tissue. The important thing when you're giving an injection is that you do want to make sure that you rotate your site. Lots of people will tell me they have this like sweet spot where they consistently inject all the time because it doesn't hurt anymore. The problem with doing that is that the tissue, the fat tissue underneath the skin that gets overexposed to insulin can start to scar. And when it scars, it's actually not going to absorb any insulin. So you might inject maybe 20 units, let's say, and maybe your body's only going to absorb 8 of those units. And we wouldn't know, we wouldn't be able to calculate that, but we would see that your dose isn't working for you. And we start increasing the dose and increasing the dose and increasing the dose because you're just not getting good, effective coverage. When technically all we necessarily needed to do was move that site around. So very important that you rotate your site, that you avoid what's on the right-hand side of your screen, which is called Lipo Hypertrophy. So this is fat tissue that has been scarred and overused essentially from insulin injections. And in this picture, you can see like there's like a lump at the surface, right, where there's kind of pink there that's supposed to represent your skin. So there's like a little lump at the surface. That sometimes happens, but not always. So before you give yourself an injection, kind of feel the area and see like, do I have any lumps or bumps there? Or is that firmer over there on that side than it is on the other side? Maybe I need to go to a more fleshy, kind of softer area on the body to do my injections. So on the left-hand side are a few different patterns that we can sometimes recommend for patients when they're trying to figure out how to exactly do I rotate. So the places where you can inject are in that center picture there. So you can inject around your abdomen. You want to stay away from the belly button area. You can inject on the outer thighs where you have more flesh, more fat tissue. You can inject the back of the arms, the underside of the arm here or here, the upper buttocks, and then again, the lateral portion of the back of the thigh as well. So within those areas, you really can do some rotation. Sometimes it's hard to do a leg injection or certainly an upper buttock injection. Sometimes even an arm injection can be difficult for some people. So if you're focusing on your abdomen, the picture on the left-hand side gives you some indication of how you can rotate that around and not use the same spot over and over again. The picture at the bottom is actually a little template that you can print out online from a BD's website, which is a needle company, and you can just literally place it over your abdomen and then just kind of decide like, okay, on the first of the month, I'm going to inject here. On the second, I'm going to inject here, and then you can just kind of rotate back around again. So it gives you a great way of ensuring that you're rotating your site often enough. As I said before, insulin is not very stable, so it does need to be stored properly, or it also will have difficulty working. So insulin requires refrigeration. When you pick it up from the pharmacy, you should not go on a number of different errands and then decide to go home and then put it in your refrigerator. You really don't want to bring it all the way up to room temperature. Unopened insulin can stay comfortably stored in the refrigerator until its expiration date. As soon as you open up a vial of insulin or an insulin pen, the expiration changes, and the time starts ticking on the expiration of that vial or that pen. Opened pens and opened vials can stay at room temperature because regardless if you keep it in the refrigerator or if you keep it on the counter, it doesn't matter, it's going to expire. Generally, they're all around somewhere between 14 and 28 days, really depending upon the type of insulin it is. So I would recommend that you check your manufacturer instructions. Mixed insulin expires much faster than long-acting insulin or rapid-acting insulin, but usually, like I said, between 2 weeks and about a month for most of them as far as expiration. So again, if it's an opened vial or an opened pen, you can keep it at room temperature, but that's room temperature, so do be careful. That doesn't mean you can keep it in your pocket of your shirt because the human body is a little bit warmer than room temperature, and so that pen, that insulin is going to get hotter faster. Doesn't mean you can keep it in your car on a hot summer day. So you can store it if you're traveling in like a little cooler case like I have pictured at the bottom, just to kind of keep it at a proper temperature. Okay. So that's insulin in a very quick nutshell. So I wanted to go over non-insulin medications because this is often where most individuals will start, especially in prediabetes and type 2 diabetes. So we're going to go through each of the drug classes on the left-hand side. Metformin is probably the drug that if you have diabetes, you've either been introduced to it, you've been on it, you are on it, or you will be on it. This is probably the most popular diabetes medication. So metformin, glucophage is another name. They have name brands of Glumetza and Fortimet. Metformin's job is to prevent the body from making too much sugar. So if you remember, I said after you eat a meal, after about 4 hours, insulin will try to store any leftover sugar either in the liver or the muscle to be used later. So your liver is a little storage house. It's also a manufacturer of sugar. And sometimes in individuals with diabetes, it manufactures and delivers too much sugar throughout the day and overnight. And metformin's job is to kind of halt that and slow down the liver production and the liver release of sugar so that there's not too much sugar in the bloodstream. It's actually a great drug. It works really well. Because of that, it starts to fight some of that insulin resistance. The problem with this medication is oftentimes it does cause some GI upset, some gastrointestinal upset. So it can be nausea, it can be bloating, it can be diarrhea. And so if those side effects become uncomfortable, you can try an extended release version. You could even try the name brand, which sometimes work a little bit differently for people, and those are Glumetza and Fortimet. But the piece to know about this is if you're starting on it, you want to start slow. So if your doctor's recommending 1,000 milligrams a day or 2,000 milligrams a day, you don't have to jump in and do all 2,000 right away. Slowly introduce it to your body, start to allow your body to get used to it. You'll find that you're a little bit more tolerant of it. Sulfonylureas, so those are medications like glimepiride, glipizide, and glyburide. These are generally next in line, potentially, as far as treatment for diabetes. These medications kind of, if you will, squeeze the pancreas to force you to make more insulin to provide coverage, either all day long or over meal times. It's important for these medications that you take them at consistent times and eat consistent meals. So if I take this sulfonylurea, this glipizide or glimepiride at 8 o'clock in the morning, I'm squeezing my pancreas for the next 10 hours or so, giving more insulin. Not a good idea to skip my lunch that day. I may need to maintain proper meals for that, okay? So because I'm forcing my body to make more insulin, I do have the potential to cause a low blood sugar. So you want to be careful about that. And if your blood sugar does drop, you would contact your physician to have the dose adjusted or altered in some way. Okay. And just to note, if you do take this medication twice a day, you should spread out those doses. So usually breakfast and dinner or breakfast and bedtime, something like that. So the next drug class, these are actually drugs that work in the same respect as the sulfonylureas, but these have a shorter duration and are meant specifically to cover your meal. So this is Prandin and Starlix. Again, they cause the pancreas to be squeezed, if you will, to release a little more insulin out during your meal time. So again, shorter duration. You do want to take this before you eat the meal. So if you already ate breakfast, you're like, oh, dang it, I forgot to take my Prandin. Too late, just forget about it. Take it for the next meal. You don't want to take it after the meal. So you take it before the meal, up to 15 minutes before. If you're not eating a meal or you're not feeling like you might be able to eat a full meal, maybe something's going on and you just don't think you're going to eat a full meal, skip the medication because, again, it can cause a low blood sugar. And so because you're taking this medication with meals, you do want to spread your meals out throughout the day so that you're not stacking essentially your dose of medication. Next drug class, DPP-4s. These medications, Januvia, Tradjenta, Onglyza, and Nesina, these allow the insulin in your body to work a little bit longer and a little bit more efficiently. So remember, again, I said your insulin comes in like a flood after you eat, and then insulin works for about 4 hours. But that's not necessarily the case in the DPP-4s because it allows the insulin to work longer. So it keeps storing and moving that sugar where it needs to go after a meal. So it really does help to kind of pull down the blood sugars after a meal so the blood sugars aren't quite so high. It reduces the amount of sugar, again, that your body might potentially make from the liver. And it also kind of slows the emptying of your stomach contents as you're kind of digesting through the body so that not everything turns to sugar right away and then the blood sugar spikes up. So it kind of allows that slow movement. So it's a slow release of sugar into the bloodstream. These are great drugs. They have very limited side effects. They're not really going to cause a low blood sugar at all. Generally, we only take them once a day. It could be in the morning or in the evening. You can take it with food. You can take it without food. They're generally very well tolerated. So again, Januvia, Tradjenta, Onglyza, Nesina. So the medications I just talked about, right? We can also have a more potent option of them in an injectable form. And these are called GLP-1s. These are probably some things that you've seen on TV. So Bydureon, Victoza, Trulicity, that's a commercial I see all the time. Ozempic, Adalimumab, and Rybelsus. Rybelsus is actually an oral pill. But same exact properties. So it's going to allow the insulin to live a little bit longer. It's going to slow the gastric emptying. It's going to reduce the amount of sugar that your body actually makes. And again, a little bit more potent than the DPP-4. So if you're on Januvia and your doctor says, you know what, I think we should try Trulicity, you should stop taking the Januvia, same drug, right? Now you're giving it in an injectable form. So just kind of tuck that in the back of your head in case, you know, you're on that medication and you move on to an injectable form. You should not be on both. So this medication, again, a little bit more potent, so it does have some side effects. It could cause some abdominal discomfort, bloating, nausea, vomiting, potentially diarrhea. So again, with this medication, just like with metformin, slow tapering up really does seem to help and seems to allow people to become more tolerant and tolerate the medication more. And these are injectables. Some are daily, some are weekly, but these are not insulin. So don't get them confused with insulin. These are completely different. Okay. SGLT2s, these are medications. I'm not sure if they market these on TV or not, but these are medications that actually work at the level of the kidney. If we think about what the kidney's job is, it's to filter our blood. Well, the kidneys recognize there's a lot of sugar right now in the bloodstream, so it tries to pull some sugar out of the bloodstream into your bladder so you can excrete that out. But these drugs allow it to work even more efficiently and pull even more sugar into the bladder so that you can excrete more of it out. And they work very well, actually. And there's actually a new indication, especially for Farxiga, for cardiovascular protection, for heart protection as well. But because these medications work at the level of the kidney, there are some risks that are involved. So if the kidneys are pulling a whole bunch of sugar into your bladder's got this warm urine in it, and now it's really sweet. So that urine, if it's sitting there for a long enough period of time, it can start to harbor some bacteria, grow some bacteria, lead to a UTI, and other types of infections can lead up to a kidney infection. So you do want to be very careful. Individuals who are on these medications do need to hydrate well. They need to use the bathroom on a regular basis. They need to be very clean when they're using the bathroom on a regular basis. And just know that they work kind of similarly to a water pill. So you take it in the morning. It's going to try to pull that blood sugar down all day through urination. And so you're going to have to go to the bathroom more often. And what I find anecdotally from patients is that if they eat a high carb meal, they usually have to go a lot after that high carb meal, which completely makes sense. So almost it can be a behavior modifier sometimes if you're like, oh, I better not have that because I really don't want to have to use the bathroom a lot afterwards. So these medications, again, you know, hydration important, and just making sure you drink a lot of water, and your physician would monitor your kidney function as well on this medication. TZDs are not necessarily used much anymore, but the goal of these medications is to improve your body's response to the insulin that you're already making. Actose and Avandia, they can cause weight gain and fluid retention, which is the reason why they're often not used, or if they are used, they're just used with close monitoring as well. These medications take a while to take effect. So you start a medication in January, you really want to start seeing results after a week or two, but you really have to wait almost 2 months, maybe even 3 months before you're really going to see how that medication is affecting you. And that sometimes is frustrating for people because they start a medication and they want to see the effect of it. They want to see that it's working. And finally, the last medications that I'm going to talk about, Carbos and Glycet. These medications prevent a lot of the carb that you're eating from being absorbed into the bloodstream. So a lot of that sugar kind of ferments in the gut and it is actually never absorbed into the bloodstream. So sounds like a great medication. However, because all of that's sitting in the gut and sort of fermenting there, if you will, a lot of GI upset. So flatulence is a huge problem with this medication and can be very severe and can be the limiting factor in patients being able to tolerate it. So with this particular medication, you're going to take it with the first bite of food. Just like any other medication that you would take at a meal, if you're not eating the meal, you would skip the medication. There's a very low risk of having hypoglycemia or low blood sugar on this medication, but if you did, you'd have to treat it very specifically with glucagon or something called dextrose, because again, most carbs are not being absorbed from the gut to treat that low blood sugar. So I know this was like a quick and dirty 30-minute review of medications. I have my contact information here for the Diabetes Education Department, as well as for Capital Endocrinology, where I work. And one of the handouts is the classes that I do run that are free on a monthly basis, and you're always welcome to attend them. They're sadly online, but maybe that's a good thing because anybody can come. I do like to see people in person though, but you're welcome to come, and they're kind of like a free-for-all. It's an hour of ask anything you want about diabetes. So I encourage you, if you have any questions, just concerns about things in general, or even very specific questions about your own issues, you're welcome to come into any of those classes and ask away any questions that you have. I would welcome it. So I guess, Andrew, we can open it up to any questions that anybody might have at this point before Mindy gets started.
All right, thank you, Laura. Yeah, as Laura said, if you have any questions, please feel free to ask them right now. There's nothing in the queue, but we can give it a couple minutes. So,
Okay.
what do you see as maybe the most common type of medication for either insulin deficiency or insulin resistance?
So for insulin deficiency, because you're deficient, you don't make enough insulin, the only medication we can give is insulin. So that would be injectable insulin. For insulin resistance, the most common medication is metformin. It's the starting point for everybody. And if you don't tolerate it, then we move on. But certainly if it's tolerated, we try to maximize the dosing on that, which is 2,000 milligrams a day.
Should these be used in conjunction with other things such as exercise, dieting, stuff like that?
Absolutely, and Mindy's going to touch on both of those things. So yes, so absolutely. So any individual with diabetes, we would recommend exercise as a part of the treatment plan, as well as not necessarily dieting, but planning your meals and making sure that your meals are healthy, all part of the big picture. Absolutely.
All right, well, I don't see any other questions, so we can change it over to Mindy for that part of the presentation.
Okay.
Okay. Can you see my presentation now?
Yes, I can.
You can. Okay. All right. Well, good afternoon, everybody. Put this here. As you mentioned, my name is Mindy Komosinsky, and I'm a registered dietitian and also a certified diabetes educator. And now that you just heard about how medications can help manage diabetes, I'm going to focus on the nutrition or the food and the lifestyle activities as food and exercise. Okay. And I really always like to start by saying, because I really believe it's true, the way that someone has diabetes or pre-diabetes should eat really is the way I think everyone should aim to eat. So I don't want you to think that, oh, now I have this diagnosis of diabetes, I have to follow this restrictive or this lousy diet. I think it's best if we think of it in terms of our eating habits, healthy eating habits. I think when we think in terms of the word diet, we often think of it as being restrictive, negative, and then it ends up being temporary. And I think it's just much healthier view to think of it as just eating habits and to focus on the positive. Oh, let me see. Okay, to focus on the positive is really the key. Most people are successful or more successful when they take a gradual approach. The goal really is not to be overwhelmed. So as I go through my presentation this afternoon, think of maybe one or two areas or goals that you'd like to work on to start on, after we have our talk. And I always think that it really makes much more sense, when we understand what's happening when we eat, as far as making these recommendations. So, as you probably know, there are three main nutrients in food: carbohydrate, protein, and fat. Most foods contain a combination of these nutrients, and these are the nutrients that give our body fuel, they give our body energy. And as you probably also are aware of, it's the carbohydrates that raise our blood glucose level the most. And when we eat foods that contain carbs for short, carbs get broken down into glucose by the digestive system. And Laura talked about this a little bit before because it helps to understand how the medications work. And I think this will help you to understand some of the recommendations that we're going to be talking about as well. So glucose is the type of sugar that your body uses for energy. And when you have diabetes, eating too much carbohydrate can make your blood glucose go up. This is a good visual of what happens when we eat. Okay, so when we eat the food, we chew it, we swallow it, it goes down our esophagus and into our stomach, where it's digested or broken down into smaller nutrients. So the foods that contain carbohydrates are broken down into the form of sugar called glucose. So that's represented by these blue, purple dots at number 1. Then after the carbs are broken down to glucose, that glucose goes through your intestines and gets absorbed into your bloodstream. Okay, represented by this number 3 right here. Okay, and as Laura had discussed just a little while ago, is that it's the pancreas that secretes the hormone insulin. And the job of insulin is then to go into your bloodstream and help remove the sugar or put the sugar into your cells of your body. That's how we use our food as fuel for energy. Okay. Now, lots of foods contain carbohydrate, right? Just by showing this slide. And I think it's so important to keep in mind too, that many foods that contain carbohydrates are healthy foods. So the goal is not to avoid carbohydrates. It really is to watch how much we have at a time and spread it throughout the day. We have foods that are in the grain category, your breads, pasta, cereal, quinoa. We have starchy vegetables like potatoes, corn, beans, and peas, lentils. We have fruits. Those are all foods that contain carbohydrate, including dairy products. But a lot of them have important nutrients, but they are broken down into sugar in our digestive system. Now I'm showing this picture that has carbohydrate foods because they do provide a lot of carbs. They do provide a lot of sugar. You think of your cakes, cookies, candy, soda, but they really don't have a lot of nutritional value. But why do we eat these foods? They taste good, right? We enjoy these foods. And I always want people to think about too, what happens if someone tells you or you feel that you shouldn't eat something? A lot of times people feel that they want it more, right? When we're told we can't have something, it's just a human nature that we tend to want it more. So I think the goal is to try to include more nutritious foods, more healthy foods, and not focus so much on what it is that we feel that we can't eat. A real important key is how much we eat. Okay, so I want you to think for a second about the impact that having or eating too much can have on your body. And I found this large plate of pasta because I want you just to visualize eating that large portion of pasta, which has a lot of carbs. So it's going to go to your stomach all at the same time. And what is that likely to do to your blood glucose? It's likely to make your blood glucose rise. Okay, and if you ate a large amount of carbs all the time, you know, what's that likely to do to your weight? Oftentimes, you know, it would make the weight over time go up. And we do know that weight gain is one of the main reasons why people develop insulin resistance. Okay. So how much you eat. And I want you just, again, I always say what I teach isn't rocket science. It's about making the connections about what we do, our eating behaviors, and how that can affect our health. So think even just, do you sometimes eat too much? And I think most of us can truthfully answer that, yes, there's times when we eat too much. And then just think about, how do you know when you've eaten too much? Okay, many people describe it as they feel kind of stuffed, bloated, tired. And it's really not a good feeling when we eat too much. The problem is we get that feeling when it's too late, right? It's after the fact. And as humans, we tend to live in the moment. So it's really, I think, very easy for us to eat too much. And that's what we'll talk about next, is why it's so easy to eat too much. And this slide just shows, and even visually, if you want to even make a fist and look at your hand, okay, that's about the size of your stomach when it's empty. It really doesn't take a lot of food to make us feel full and satisfied. The problem is once the food goes to our stomach, it takes our stomach about 20 minutes to send a signal to tell your brain that you're full. 20 minutes is a long time. So it's easy to eat more food than we actually need, which is why we usually get that feeling of fullness when it's too late. I think this slide just kind of gives a good visualization of what's happening too. Think about how long it takes for you to eat one slice of pizza. And many people, when I ask that question, they say, oh, it just takes a couple of minutes. You know, at most, maybe it takes 5 minutes to eat a slice of pizza. So chances are, after you eat that slice of pizza, you're going to be thinking, I'm still hungry. I want more to eat. So you might get that second slice of pizza, and then maybe 10 minutes went by, and you still feel hungry. You want another slice. It's very easy to eat, you know, in that 20-minute period, more food than our body needs, and you really will feel full with a smaller amount. It's just waiting it out till you get that feeling of fullness. So let's talk about some strategies to help with that. Some strategies that might just help with eating smaller portions. And again, some of these seem kind of obvious, but again, it's just kind of thinking about your current habits and seeing what strategies you can implement. It might just be putting a little less food on your plate, just a little bit at a time. You might try drinking a glass of water before meals, or definitely taking sips of water between your bites of food. Salad before meals or with meals often can just help to give you that feeling of fullness more when you should, rather than when it's too late. There's been multiple studies that have really shown that when people use a smaller plate, they eat less food. And this picture kind of visualizes how it's the same amount of food on two different sized plates, but visually it tends to look like more on the smaller plate. And I think the other reason why it helps to use the smaller plate is when we have a larger plate, we tend to put more food on the larger plate, right? There's more space, so we're more likely to fill it up. So try using a smaller plate at home. Eat slowly. I think with our fast-paced, world, with work, school, we were trained to eat quickly. If you slow down, it really can help you to feel satisfied with a smaller amount. So after you take your mouthful with your fork, put the fork down between bites. Again, take drinks or sips of water between bites. Look at the food, smell it, really taste it. And I find that if you eat slowly and you really enjoy the food, you'll also be satisfied with a smaller amount. Okay. Some more tips. Put food on the plates in the kitchen rather than putting the food on the table. And you can probably think about why that might be helpful, right? If you had the food right on the table where you're eating, it's just too easy to reach over and to grab, say, another piece of chicken or take another scoop of rice. But if the food is in the kitchen, hopefully you'll think before you get up out of your seat and think, you know what? Do I really need more? Maybe if I just wait it out, I'll get that feeling of fullness more when I should. And it might help to stop you from going back for seconds. If you want to put vegetables on the table, that would be a great thing to do. If you find you still always go back to the kitchen for more food, you might want to, everyone takes their plates of food and then right away put the extra into containers, so that way you have it for another meal. It'll be good and easy to go. Did you know that it's okay not to eat everything on your plate? Were you brought up that way? Most of us were brought up to finish everything on our plate. Don't waste food, right? There's starving kids in whatever country your parents said at the time. And I really understand, why this is so hard for people. We don't like to waste food. But I read something once that really had an impact on me. It said, if you eat everything on your plate just because you don't want to throw it away, it's really like using your body as a garbage can. The extra food can hurt the garbage can, but it can hurt your health. And that just made me think of it in a different light. Of course, if we can, save the extra, wrap it up, enjoy it at another time, that would be the great thing to go. But the reason why I chose this, plate of food where this is usually when we say, well, there's really not enough to save, so I'm going to, eat it. But that's the perfect time to say, you know what, I'm done, I'm full, I'm satisfied, it's really what my body needs, and it's okay to throw it away. It's important, I think, to really remember this when you go to restaurants or when you have takeout meals. Oftentimes the portion sizes can be very large, and oftentimes you can get even 2 or sometimes more meals out of a serving. So think of ways that you can just watch the portion sizes. Okay. And this is just illustrating that. She's saying, I wish I could lose weight as easy as I lose my keys, pen, cell phone, my temper, and even my mind. We know weight loss is not an easy thing to do. And I think for some people, even just focusing on maintaining weight or preventing further weight gain is a good strategy, or just a very slow, gradual weight loss can be really helpful in just helping with the insulin resistance and keeping blood sugars within a healthy range. So let's think about some meal planning strategies. I think this is one of the most important things for people with diabetes, but I also really encourage people that don't have diabetes to follow this eating plan or method. So when you're looking at your plate, ideally, a quarter of the plate should be your meat or protein. So your chicken, fish, turkey, lean beef, fresh pork. A quarter of your plate should be your starchy foods. That would be things like your noodles, rice, pasta, potatoes, and ideally half the plate should be loaded up with those non-starchy vegetables. Those vegetables are low in carbs, they're low in calories, they're low in vitamins, fiber, nutrients that have really been shown to protect us against many health issues. So the goal is to try to include more vegetables on the plate. And this method can be used to come up with so many different meal combinations. Here's just some examples. So these all have a protein, whether it's salmon. Here they even use some hummus or some, ground meat. There's some carbs on each plate, whether it's rice or some pita chips or some tortillas. And then, of course, try to fill up the plate with lots of those non-starchy vegetables. Here's some more examples using the plate method. There's just so many different combinations that you can come up with using this method. These are some examples that seem more like lunch type examples, although there's nothing that says you can't eat lunch type foods at dinner or dinner type foods at lunchtime. But again, the goal is to have some protein. The first example is with some tuna fish for the protein. Your bread would be your carb or your starch food, and then to have salad or vegetables with that. Here they're using garbanzo beans for the carb choice, which is actually a great carb choice because it's high in fiber and protein, so it tends not to raise blood sugar as much as other carbs. Here, they use crackers with cheese and vegetables. So try to keep the plate method in mind when you're coming up with different combinations for your meals. And I want to just include some breakfast examples because I don't think it has to be a meal that takes a lot of time, especially if you're in a rush in the morning. But it's always good to include some carbs and some protein. So peanut butter or other nut butters would be a great choice for protein. Nuts even would be a great choice. You can put the nut butters on an English muffin, on whole grain bread, on a waffle, even in your oatmeal. Some good examples. Eggs make a great protein choice for the morning as well. And if you cook up some hard-boiled eggs maybe on the weekend, and then you have them in the refrigerator, it can be just such an easy way to get some protein in the morning. I often, as a matter of fact, I did it this morning. I cooked my eggs in a mug in the microwave. I do add a little bit of shredded cheese. You can add any leftover vegetables to it, but it's a really easy way to cook vegetables that's very, very quick and easy. And again, if you had it with an English muffin or some whole grain toast. So just some examples. And then what to eat, right? We talked a little bit about how carbs affect your blood glucose and how reducing portion sizes may be helpful. So now let's just talk a little bit about what we should put on our plate. And really the goal is a variety of foods. We want to eat foods from all the food groups. We don't want to eliminate foods. Oftentimes when people eliminate whole food groups, it's hard to maintain and it's hard to stay on anything like that for long periods of time. I always encourage people to have more plant-based foods in their regular schedule because they provide, again, a lot of fiber, vitamins, phytochemicals, antioxidants, all the things that help to lower cholesterol, blood pressure, decrease inflammation in the body, which tends to cause a lot of health issues as well. But lean protein is very helpful to have at meals. We know that it helps to keep you feeling full longer. So when we talked about the quarter of your plate, having some protein choices, lots of variety would be great there. Whole grains, whether it's brown or wild rice, there's a lot of whole grain pastas, quinoa, oatmeal, These are all great choices. And whenever a food is less processed, it tends not to raise blood glucose level as much. So look for foods that are less processed and just keep them on about a quarter of your plate. Beans and lentils are great choices too, as far as they do contain carbs, but they contain the fiber and protein with them. So I always say try to include more beans. They're inexpensive. They're very versatile, whether you have them in soups, you can make chili. I like to add a lot of vegetables when I'm cooking chili. Salads, when the weather gets warmer, we tend to sometimes eat more salads, and beans are a great base for your salads. And since I'm always encouraging people to eat more vegetables, I think it's important to come up with new creative ways, or ways that you enjoy eating them better. And one of my favorite ways to eat vegetables is to roast them. I think they just taste much sweeter. When they get a little caramelized, the flavor comes out. So try roasting cauliflower. Roast really well, Brussels sprouts, asparagus. You can do different mixtures of vegetables. Grilling vegetables have a similar flavor and texture when you cook them. Sauteing vegetables is a great way also to eat them. You can even saute frozen vegetables. I find that they're an easy way to prepare them. Of course, microwaving or steaming are healthy ways too. You just want to be careful that you're not adding in a lot of extra butter and cheese and things to give them some flavor. Okay. Salads, again, great way to add more vegetables. And there's so many different combinations that you can do. And if you add some protein, whether it's an egg or tuna fish or chicken, you can make a meal out of a salad, but definitely as side dishes, or make up a batch and, put it in containers and have it during the week. And especially if you put a little oil and vinegar type dressing on it, that's a great way to add some healthy fats. Usually I recommend olive oil or canola oil. On salads. You just don't want to use the the olive oil when you're cooking at high temperatures. Okay, but they're good for lowering cholesterol. Let's talk a little bit about the timing of meals. And Laura gave some good examples with some of the medications that you don't want to go a long time without eating when you are taking some medications. I also think it's important not to go a long time without eating, because oftentimes when we wait until we're starving, if we skip meals or a long time goes between meals, we tend to eat more at the next meal, or we might grab a snack that might not be the healthiest choice. We just grab anything because we want to satisfy that hunger. And when we're very hungry, we tend to eat faster and we tend to eat more. So I do think it often works best to have breakfast, have some protein with your carbs at breakfast time. If there's more than 4 or 5 hours between meals, because that's just the way your day normally goes, then I would plan to have a snack in between. I think that's always the key word, is just to plan the snack. When we don't plan, again, that's when we grab anything. So snacks can be fine. It's just planning ahead. And the other thing, just as far as snacks go, is just to ask yourself before you look for something to eat, if it isn't a planned snack or a time when you normally would have something, just ask yourself, am I really hungry? I think a lot of people eat when they're not hungry, when they're bored, stressed, out of habits. They might be lonely while they're watching TV or someone else is eating. There's many reasons why we tend to eat. And it usually is that eating that we do when we're not hungry and that's not planned that tends to also increase our weight. So if you're not hungry, then just say to yourself, all right, well, if I'm not hungry, why am I looking for something to eat? First, identify what the problem is, and then say, okay, well, then let me do something else instead. Sometimes it's just identifying that, what, I'm not really hungry. Is there some, something I can read, put on music, do other activities. I've been doing a lot of deep breathing, especially during this, stressful year. Some chair yoga. You might go for a walk, read a book, listen to music. So find other things you can do, because if food is our only coping mechanism or skill, then it could lead to health issues. And then as far as snacks go, these are just some pictures of some snacks that you might want to keep on hand. I think a lot of times when we think of snacks, we think of chips or cookies because they're quick and they're easy. But instead, you might plan to, have popcorn, or to have a small handful of nuts is a great choice for a snack, especially for people with diabetes, because nuts are low in carbs and they have the healthy fats. So that would be a great choice. Some nut butters with fruits like the apple and fruit, a banana, and peanut butter. Apple and peanut butter. Pistachios are great because it takes a little more time to eat them. Cheese sticks are a great go-to. Hard-boiled eggs, fruit are all good examples. Sometimes even a compromise. I might really want something that's kind of crunchy and salty like the tortilla chips, but if I just take a small amount of that and then have it with some raw vegetables, the combination tastes nice together, and I tend to eat a lot less of the chips. And you're getting in some healthy vegetables. And really the key is portioning the snacks. Use small containers or bags. Avoid sitting down with a whole box or bag of snacks. And again, to portion them ahead often will help with overeating. I find if I even portion my snacks when I'm going to work in the morning, if I put them in little bags or containers and then I have them throughout the day, it just makes it so much easier to grab, and you're less likely to eat a large amount if you have the whole bag in front of you. Beverages, this is a key area too, just to think about, because beverages can really add a lot of extra sugar and a lot of extra carbs to your day. So ideally, water is a great choice. Seltzer is a great choice. There's lots of different flavored seltzers and different types now. Sparkling water. You can add fruit to your water or seltzer if you like. Iced tea or hot tea, coffee are great choices too. You just have to be mindful of what you put in them. There's sugar substitutes if you want to use them, if you really, or try to have them unsweetened, or if you do add sugar, limit it to no more than 1 teaspoon per serving. Also, a whole piece of fruit is always better than the juice, because juice, it's natural sugar, but it has the same effect on blood glucose. So you definitely want to watch the portion size of that. Do you know how much sugar is in 1 can of soda? Right now you do. It's 10 teaspoons. 10 teaspoons of sugar. That's a lot of sugar when you think about it. And again, it's liquid, so it very quickly goes to your stomach. It's digested. It's already digested. Blood sugars tend to rise very, very quickly. 1 can of soda has about 40 grams of carbs in it, which is a lot. Especially if let's look at this slide. So we talked about the plate method, which I really think is a great method for helping to plan meals and helping with your carb portions. But for some people that might want a little bit more info on how much carbs to aim for per meal, good suggestion to start is for women to aim for about 30 to 45 grams of carbs per meal, especially if you want to lose weight, oftentimes even using the lower end of the ranges, and you can save one of the carb choices for a snack. So it might be, for women, between 30 and 45 grams of carbs per meal, and for men between 45 and 60 grams of carbs per meal. It is very individual. It depends on your height, your weight, your activity levels, your goals for weight loss, but this is often a good place just to get started to keep in range. So you might even aim for, 45 grams of carbs per meal if you're a man, and then save 15 grams of carbs for a snack in between. Kind of play around with it and see what works best for you. And often testing blood glucose levels is the best way to see what really does work for you. So now that we kind of have a guideline for how many grams of carbs are recommended for a meal, I just want to take a look at a couple of food labels. And when you're looking at the food label, the first thing you always want to do is look at the serving size. Okay, so on this label, you'll see the blue arrow points to the serving size, which is 2/3 of a cup. Okay, and that's because all the information that follows is based on that serving size, not necessarily the whole package or container, just what's ever in that serving size. And then scroll down and you'll see where it says total carbohydrate. And that total carbohydrate is in a bold print. You'll see the green arrow points up to 37 grams. Okay, so there's 37 grams in 2/3 of a cup of whatever this product is. You'll see underneath total carbohydrate, it lists the dietary fiber and total sugars. Those are included in the total carbohydrate. And once you chew and swallow the total carbohydrate and it goes to your stomach, it's almost instantaneously broken down into sugar. So it really is that total carbohydrate number that we look at when we're spreading out the carbohydrate foods throughout the day. So if you were aiming between 30 and 45 grams of carbs per meal, 2/3 cup of this food would work in your meal plan. Okay. Just to show you this I took this information off a loaf of bread, and it said on the label that the serving size was 1 slice and the total carbohydrate was 15 grams. So one way that you might even use the food labels is think about how many grams of carbs were in 2 slices of bread, right? Maybe you want to have a sandwich and you want 2 slices of bread. So, right, if 1 slice has 15 grams, 2 slices would have 30 grams of carbs. So if that's what you were aiming for that meal, great. If you were aiming for 45 grams of carbs, you can make another food choice that has about 45 grams of carbs. Okay. So some things to think about as far as your current eating habits, and just think about meal planning approaches and your portion sizes and some of the mindful eating that goes along with it. And next, we're going to talk just a little bit about physical activity. Because I always say I can't talk about nutrition without talking a little bit about physical activity. There's so many benefits of physical activity, including it can improve your blood glucose control. And I know that's what we're talking about today, but we also want to keep our blood pressure in a healthy range, improve our cholesterol, or just keep our heart strong, because our heart, remember, is a muscle as well. Physical activity can reduce body fat and our weight. It improves immune function, reduces psychological stress, mood enhancement. We get that nice serotonin going to our brain. We even tend to sleep better when we have physical activity. So we know there's so many benefits of physical activity. For most people, it's just a matter of working it into their day. And goals for good health, generally, at least the minimum is we really should aim for 150 minutes per week. And that can be broken down into 30 minutes per day, 5 days a week would give you that 150 minutes per week. So if you think about 30 minutes per day, most, in our 24 hours that we have in a day, I think that would be a great way to try to work it in, but it can be broken up. It doesn't have to be all at one time. And I think that's very important too, because sometimes we might say, I just don't have that 30 minutes, I'm too busy or I'm too tired, but you might find you can break it down into 2 15-minute sessions a day, or 3 10-minute sessions a day. Do whatever works best for you and your schedule. Okay. And again, some is better than nothing. So a realistic, quick start goal might even be to say, just let me aim for 10 minutes a day, right? How can I get 10 minutes or 10 minutes more of activity into my day? Start slow. And there's lots of little ways that we can get in more activity also. I mean, it doesn't mean you need to go to a gym. You can just park your car further from the entrance. I go really far in the parking lot here at the hospital. It's a big lot, and I'm at the end. I now wear sneakers, into work, or sneaker-like, shoes that are comfortable, and it makes it so I know I get a nice walk in the morning coming in and going back to my car. Try to use the stairs instead of the elevator when you can. When you go to the bathroom, take a walk around. So whether you're working from home or you're working in an office, try to add a few extra steps whenever you go to the bathroom. Use the upstairs bathroom. I do that in my home. Instead of using the one that's right downstairs, go upstairs. Again, any way to get in more steps, I think, can really be helpful. March in place while watching TV or cooking. Sometimes while I'm cooking, I'll do some laps around the house. Just to get moving while you're standing there anyway. Little things can make a big difference. The goal is just to sit less, move more. If you can incorporate a walk after lunch or dinner, hopefully now that the weather's going to start getting nicer, I think it's easier to get in more activity. Walk around while talking on the phone. I like to do that as well. March, stand, or stretch while watching TV. And after you've been sitting for 30 or 60 minutes, try to at least stand or at least take a little walk around. So that can really help. If you have a dog, you can walk your dog. Cleaning your house and gardening is definitely activity, so don't forget that. Really, every step counts. Some people like to aim for 1,000 steps per day. I'm sorry, did I say 1,000? 10,000 steps each day, which is equal for most people about 5 miles of walking, depending on how tall you are and what your stride pace is. But sometimes wearing a pedometer, or a Fitbit, or having an app can really help motivate you to increase your steps. And again, if you do a normal day and you only get 2,000 steps in without any activity, just keep challenging yourself to gradually increase a little bit more. So to sum things up a little bit, I think it's often helpful just to think about your current eating habits. Think about, do you eat quickly? Do you skip meals? What are some of your meal choices, snack choices, your beverage choices? Think about portion sizes, if you're eating when you're not hungry, that emotional eating, your physical activity, and just come up again with just 1 or 2 goals. Start small. I think that we really tend to make changes better when we make them very gradually. Okay, gradual steps to health. So choose 1 or 2 goals, 1 step at a time, and as you make those goals, keep up with those, and then try to focus on something else. If it's more doable, you're more likely to stick with it. Okay, so thank you for taking the time to come and join us for our presentation today. I hope you learned something new, and I would be happy to take your questions. And Laura was telling you about some of the classes that we have on Zoom for diabetes, and I do a nutrition one every month too, where I'm there to answer questions, and I do a similar often presentation just as a review. So if you'd like to join, or if you know anyone else that you think it would be helpful, please give them our information. And have a good day and stay well, everybody.
Thank you, Mindy. If anybody has any questions, please feel free to send them over and we'll be happy to answer them for you. One question came in. I'm looking for a pre-diabetes class. Where can I find one?
So is Laura still with us too?
Yeah, I heard that. I figured I'd just pop in. So the classes for Speak to the Certified Diabetes Educator, they're monthly, they're 1 hour long classes. It's a perfect opportunity to come in. We usually do like the basic starts of pre-diabetes. So the exercise piece, the nutrition piece, all of that. That would be great.
Yeah.
What's your favorite snack?
Personally, or my favorite snack for someone with diabetes. I like to do little combinations, like I mentioned before. I find nuts, like a small handful of nuts. I actually think that if everyone had a small handful of nuts every day, it could really probably improve both blood sugars and even our heart health. So especially pecans, almonds, walnuts are a great choice. Pairing that up even with a little piece of, a little bit of fruit, berries are really a nutritious fruit choice. The little oranges, like the mandarin oranges, are great too. They're a perfect size. So I find that's really helpful. A little bit of peanut butter with fruit, I think, is great. Popcorn, what else? Yogurt is also a great choice. It's very portable and easy to take with you. I do like the raw vegetables and hummus. And like I said, that oftentimes if I wanted a little something, with that, I might have a little bit of the chips with the raw vegetables and the hummus just to make it a little bit more exciting. Trying to think what else. But those are good choices. Even a cheese stick, like a mozzarella cheese stick, it's also a very low carb snack that you can have with, some raw vegetables or with fruit. It's nice and portable.
Alrighty, well, I don't see any question. I test my sugar Morning and 2 hours after beginning dinner. Any quick comments when a reading is out of range?
Okay. And one thing that I'll just even add, that I think that those are useful times to check. That's usually when the doctors will ask you to check blood sugars. I personally, as far as the food aspect goes, if you really want to learn how different meals and portion sizes can affect your blood glucose, you might want to try even doing some testing in pairs, which basically means you test before the meal. So for example, let's even think of dinner. Say you eat dinner at 6 o'clock. You would test your blood glucose before dinner at 6, eat your meal, try to even estimate your carbs, write it down, and then check your blood sugar again 2 hours after the start of the meal. Because that's going to really show you how that meal and that amount of carbs, what effect it had on your blood glucose. Ideally, we don't really want to see it rise more than 50 points from before to after, to the 2 hours after the meal. So that's one guideline. To meet the American Diabetes Association guidelines, they want to see blood glucose fasting or before meals less than 130, and 2 hours after the start of the meal less than 180. If that happened on a regular basis, then your hemoglobin A1C, if you're familiar with that number, which kind of gives us a weighted average of what your blood glucose level's been over the last 3 months, would be less than 7. Some groups even want to see the numbers a little bit lower. They want to see, after meals less than 140 or the fasting less than 110. I always say it depends where you are and what your goals, are. So generally, right, 2 hours after meals, it should be less than 180, and before meals, it should be less than 130. Based on the American Diabetes Association guidelines. But I think testing in pairs really gives you more information just to help you manage your blood glucose better going forward. And I always like to give the example too. Say you only checked your blood glucose after dinner, right? And just for example, say it was 200 after you ate dinner. If you didn't check it before dinner, you really don't know if your blood sugar was 100 before you ate and the meal made your blood sugar go up 100 points. Maybe your blood sugar was 160 before you ate and the meal only made your blood glucose go up 40 points. I don't want you to blame the meal if it wasn't the meal's fault, right? So that's why it can be really helpful to check it in pairs. And you don't have to check before and after every meal. You might just pick one meal and for the next, 3 or 4 days, do before and after. So after you do dinner for a few days and you see how different foods and portion sizes affect your blood glucose, you might switch and say, let me focus on breakfast for the next few days. Check your blood sugar right before you eat breakfast. And again, check it 2 hours after the start of the meal. And that can really, I think, give good information. I always say there's no good or bad numbers. It's just information to help you manage your blood glucose going forward.
You have anything to add, Laura?
Yeah.
No, that was perfect. So went over the guidelines and the goals for eating, absolutely. So it's not always the food that you eat. So checking before and after is really the goal there, because you don't want to blame something that's not the situation. But, as far as an after meal reading being high, it doesn't necessarily have to be the food. It could be the situation surrounding the meal, stress. There's so many other things that are going to affect the blood sugar. Maybe you generally take a walk after a meal. You opted not to take a walk, so that could affect it as well. So, so many pieces that can affect that. It's hard to really list all of it right now and talk about all of it right now, but testing before and after meals really gives you a good indication, and 50 points is your starting guideline as far as what a sufficient rise is.
All right, well, it looks like that is everything. So I'd just like to take this opportunity to thank you, Laura and Mindy, for a fantastic presentation. I'd like to thank everybody who attended today. You make our programming worthwhile. And I just want to finish off by saying, be safe, be well, and hopefully we'll be able to see you in person soon. So.
Yes, absolutely. Thanks, everybody.
Yeah, have a good day, everyone. Bye-bye.